Hi, welcome everyone this evening to our Cecelia Health Basics of Chronic Kidney Disease webinar. I'm Emily. I'm one of the diabetes educators and dietitians, and welcome for joining us tonight. Tonight, Nancy will be also a dietitian, will be our presenter. Here at the bottom of the page is the phone number if you're having any issues, 800-263-6317. And next slide, please, Nancy. I'm assuming it got stuck. There we go. Okay, so this is an interactive program, which means that the idea for this presentation is Nancy will be going through a short presentation, and then at the very end, there is time for some Q&A. So if you have any questions at any point, please put that in your questions toolbar off to the right-hand side of your screen, and she will be happy to address those at the end of tonight's webinar. Now, as always, we like to say a disclaimer that the Cecelia Health registered dietitian will provide strategies to help you manage your CKD. And we know that this information may motivate you to make some changes, but please do talk to your doctor before making any changes. This online Q&A session is intended to give general advice, and this information is not a substitute for your personal medical advice and involves the professional opinion of the Cecelia Health RD as well. So tonight, I want to introduce Nancy Cohen to everyone, and she is a licensed registered dietitian and presently works in Pennsylvania. She has her degree in nutrition and dietetics from the University of Florida and has been working in the nutrition field for over 40 years. She educates clients in all areas of medical nutrition and wellness and is a happy member of the Cecelia Health team. She's a mom of an adult 31-year-old son, has a passion for her beautiful Weimaraner dog Dinah, and she loves to work with all of her clients online in the Cecelia Health CKD and weight management programs. She brings a positive attitude to all on ways to incorporate good nutrition into life and makes the most out of every day. So thank you all again for participating, and I'll hand it off to Nancy. Thanks, Nancy.
Oh, thank you so much, Emily. And I'm also a dietitian in Florida and in Minnesota. So I get to work with lots of wonderful Cecelia Health clients. All right, everybody. Tonight's webinar is on chronic kidney disease. And I'm happy to be your presenter. I'm one of the dietitians at Cecelia Health. So we are going to speak about these 4 areas: what your kidneys do and how they work, what is chronic kidney disease, some information about the staging and progression, and then some reliable resources for managing some of these challenges. So away we go. So kidneys, most people have 2 kidneys, and the kidney is about the size of an adult fist. It's located on either side of your spine below your rib cage. And your kidneys have very important functions. They help remove waste and excess fluid. They filter the blood. They make vitamins that control growth. They control production of red blood cells. And they release hormones that regulate blood pressure. Such important tasks. The topic tonight is chronic kidney disease, and chronic kidney disease, or CKD as we refer to it, also can be called chronic kidney failure, and it involves a gradual loss of kidney function. More than 37 million American adults may have CKD, and most are undiagnosed. Advanced chronic kidney disease can cause dangerous levels of fluid, electrolytes, and waste to build up in your body. And this disease, this chronic kidney disease, can cause damage to your kidneys, and it happens slowly over a long period of time. CKD can also cause some other health problems. So how your kidneys work: first, the blood enters the kidneys through an artery from your heart. Then the blood is cleansed by passing through millions of tiny blood filters called nephrons in your kidney. Then the waste material passes through your ureter and is stored in your bladder as urine, and then you have newly cleansed blood that returns to the bloodstream through the veins. So your kidneys are a really important filtering system. In CKD, or chronic kidney disease, there were several different risk factors, and none is more prevalent than another, but here are some of the ones that can be a challenge. So diabetes can be a risk for chronic kidney disease. High blood pressure can be one of the components. Heart problems or a stroke can be part of the issue. Being overweight or obese can lead to some chronic kidney disease. If you have a family history of chronic kidney disease, tobacco use can affect your kidneys. And then age, as we age, often it can affect our kidneys as well. And other factors are some of your genetic makeup, like being Black, Native American, or Asian American. Again, having that family history, if someone in your family had chronic kidney disease, it's something to note. Having an abnormal kidney structure, which we would only determine medically, and also including consistent use of medications that can damage your kidneys. Complications of chronic kidney disease, or CKD. Fluid retention, which could lead to swelling in your arms and legs, high blood pressure, or fluid in your lungs, or what we call pulmonary edema. So fluid retention is one of the challenges of chronic kidney disease. Another one includes a sudden rise in potassium levels in your blood, which can be challenging or damaging to your heart's function and can be life-threatening. Anemia, or low iron levels in your blood. Heart disease, weak bones and an increased risk of bone fractures, and decreased sexual function can also be a side effect or challenge with chronic kidney disease. There are more, okay, including damage to your central nervous system, which can cause difficulty concentrating. Some people have personality changes or seizures. Another complication could include decreased immune response, which makes you more vulnerable to infection. Pericarditis, which is fairly serious, it's an inflammation of the sac-like member around your heart. Pregnancy complications can carry risks for the mother and the developing fetus. And irreversible damage to your kidneys, or end-stage kidney disease, eventually requiring either dialysis or a kidney transplant for survival. So we're bringing them up. We are not saying that you will have them all. These are topics you absolutely review with your personal physician. So what are some of the symptoms of chronic kidney disease? Some people experience nausea, vomiting, loss of appetite, fatigue and weakness, sleep problems, urination challenges, blood in the urine, painful urination, frequent urge to have to go, decreased mental sharpness, muscle cramps, swelling of feet and ankles, dry, itchy skin, high blood pressure, shortness of breath, and chest pain. So again, as with the previous slide, this does not mean that if you have chronic kidney disease, you have to have all of these. You may only have high blood pressure or swelling, or you may have shortness of breath. There's no combination except those that you would, again, clarify with your physician. Okay. So if you're on the webinar, it's because you have an interest in this, and not everybody has the same stage, and that's the good news. So let's take a look at the 5 stages of chronic kidney disease. They're actually interesting, and sometimes we work just with the lower one, stage 1, 2, or 3, and that's really good news. So let's take a look together. Stage 1 is the stage where you might not have any symptoms, but you might have some other signs of kidney disease, like some protein in your urine. Stage 2, you may not have any symptoms, but you also may have protein in your urine. Stage 3, you may be experiencing high blood pressure and some bone disease as waste begins to build up in your body. And there's two stages of 3A and B, and we'll talk a little bit that when we look at the other lab tests. Stage 4, that's moving closer to more serious kidney disease. The waste builds up and it may cause high blood pressure, bone disease, and heart disease. And you likely have symptoms such as swelling of your hands and feet and pain in your lower back. This is the last stage prior to kidney failure. And stage 5, if you get to that, your kidneys are close to failure or have already failed. And since you're not able to filter waste out of your blood, you could become very sick. And you would be on either heading towards dialysis or on the list for a kidney transplant. The good news is there are still solutions, but once you get to stage 5, you're moving in a new direction. So thank you. So this slide is one of the slides that talks about blood tests, and these two tests help determine which stage of chronic kidney disease you might be in. And you may have spoken about them with your personal physician or medical team or your dietitian if you're working with one of the nutrition coaches here at Cecelia Health. So GFR is one of the blood tests that they look at. And GFR stands for glomerular filtration rate, and it is the main test for kidney disease. The GFR checks how well your kidneys are filtering your blood. So you can ask what number GFR you have. The higher it is, the better it means that you're filtering. The lower it is, it helps determine which stage you're in. We can even go back and look at that slide again. Another test that we look at, so the first one is GFR blood test, glomerular, say that 3 times fast, glomerular filtration rate. That's one of the little cells in the kidney, how quickly that the blood is clearing through there. The other one is called the microalbumin urine test. So this is a urine test, and it helps reveal abnormalities that point to kidney failure. So albumin, it's a protein, and it can pass into your urine when the kidneys are damaged. So that's a measurement that we look at. Another one is similar to the albumin in the urine, is called the albumin to creatinine ratio, ACR. So ACR, so that's one of those tests where we're calculating the albumin and the creatinine and looking at the comparing them to each other. And it is calculated by dividing the amount of urine albumin. Oh, I'm sorry. I don't know why my slide just went off. There it is. Sorry. One sec. Did you see that? Okay. I think my computer took a little nap. This is very interesting, though, computer. Stay awake.
It looks good now.
I know. Isn't that funny? My computer just said, no, no, no. Okay. Back to the albumin creatinine ratio. The ACR is calculated by dividing the amount of urine albumin by the amount of urine creatinine. And higher amounts of albumin in the urine can be a sign that your kidneys are not working as well as they should. And again, all of this is shared with you from your physician. And so another test is called imaging, and they do an ultrasound to take a look at your kidney structure and size. And then there is, of course, a biopsy, which your doctor would perform, and it removes a sample of kidney tissue, which is sent to a lab for testing. So we looked at 5 different forms of tests that you can look at to evaluate your kidney health. So what can you do? Well, you're not going to draw your blood and you're not going to do your own ultrasound, but you can take care of yourself. So let's take a look at some of the tools we have here to help you manage chronic kidney disease. 1, work on controlling your blood pressure, whether that's with medication or eating. Having healthy blood pressure or the best blood pressure that you can is a great asset to helping your kidneys. 2, Control your blood sugars. If you have diabetes, it's so important to maintain your medication and eat a healthy diet. So, working with diabetes management can definitely have a positive influence on your kidney health. And three, I know there's no numbers here, but I'm just calling them out. Monitor your kidneys with your healthcare team. Take your medications as prescribed. Work with a dietitian either here at Cecelia Health or through your physician and create a meal plan. Get some exercise. Make exercise a part of your routine, whether that's walking or whatever it is that your physician says that you're allowed to do. Work on managing a healthy weight because the more weight you have, the reason we talk about weight, by the way, I'm not sure if it's in one of the future slides, is having extra weight affects your blood pressure. Having high blood pressure affects your kidneys. So we invite you to work on managing your weight so that you have good or better kidney health. Another important component is working on getting a good night's sleep or getting adequate sleep. Not smoking or quitting smoking is very important for good kidney health. And lastly, finding healthy ways to cope with stress and depression is just so important for your, not just your kidney health, but your overall welfare. Wonderful. All right, well, let's look at some of the medications. And again, this is between you and your medical doctor, and always, follow directions. That's your job. There are no specific medications to treat CKD or chronic kidney disease. However, your doctor may prescribe medications to help prevent and manage health problems related to this medical challenge. So, for diabetes, they may offer you insulin or oral medications. If you do have high blood pressure, there are several different classes, and again, your doctor will choose the best one for you. ACE inhibitors, angiotensin receptor blockers, beta blockers, and diuretics. And for heart disease, they may repeat some of those and use diuretics, ACE inhibitors, beta blockers, and potassium binders. There are some for high cholesterol, which are in the statin family. You may need something for anemia, and so we have iron supplements and erythropoiesis stimulating agents, and that basically means that it stimulates production of red blood cells. If you have metabolic acidosis, which is something your doctor will determine, they use sodium bicarbonate. If you have bone disease, they use phosphate binders and calcium and vitamin D to protect you. And secondary hyperparathyroidism, they use a calcimimetic or calcium or vitamin D. So it's just important not to treat yourself with vitamins, but make sure you're running them past your doctor because they're very nutrient specific when it comes to your kidneys. And last but not least, we love our resources here at Cecelia Health, and we always like you to use the most credible ones around. So you can always go to the National Kidney Foundation website to check the facts on the current information on kidney disease. You can go to the Center for Disease Control and Prevention. You can go to the National Institute of Diabetes and Digestive and Kidney Disease. The American Kidney Fund has lots of really useful tools. And then, of course, is the American Diabetes Association. And we love to use these for articles and also look up recipes if you're looking for special recipes. So, feel free to search through some of these. So I have covered a lot of important topics. Again, they're all led by your physicians. They are the ones who will tell you what stage you are at, what food plan you should be following, what exercise you can do. Make sure that you're checking in with your doctors and taking really good care of your personal health. Does anybody have a question? If you do, you can just type it into the chat. I know that it's always been, I've been working in chronic kidney disease here at Cecelia Health for the last 2.5 years, and I have seen so many clients either stabilize their chronic kidney disease or improve their blood pressure or decrease their swelling just from watching the nutrients in their diet, from eating fresh fruits and vegetables on their particular food plan. And we've had just really positive, positive assistance with it. Can we cure their kidney disease? I'm not sure about that, and I would never make that claim. But I would say that following the directions and guidance of your doctor and your team nutritionist can be a great asset to you. So I'll just give you another minute. If you have a question, type it in the box. One of the questions that comes to mind for me, though, is what if you don't have high blood pressure? Do you have to watch the sodium in your diet? And I've had that asked to me a bunch of times, and the answer is, well, yes, kind of, because even if your blood pressure isn't high, eating foods very high in sodium can still make your kidneys have to work hard. So do your very best to practice label reading and do your very best to eat fresh fruit foods, including poultry, fish, and meat that has not been smoked or salted or cured, even though that sounds like such a healthy thing. But watching your nutrition intake of salt can be, while sodium is allowed, there's always a cap on it. So make sure you go over that with your team dietitian.
Well, Nancy, thank you so much again for presenting tonight, and thank you everyone for joining us. We do have some webinars here coming up here for the next couple of months. We have, let's see here, I'll go ahead and bring them up. Here in
I just put
February,
the slide up. There you
oh,
go.
thank you. There we go. There we go. It worked. In February is CKD and cardiovascular disease. We kind of combine the two and talk about them in combo. And in March is healthy eating with CKD. So again, a lot of information. As always, you can also ask your Cecilia Health dietitian who you are working with, like for more information, or if you have something really specific, ask them, ask your doctor, but we are just another part of the support team. Cecilia Health is also on Facebook, or you can also check out our website as well. But thank you everyone for joining us. Thank you again, Nancy, for your time, and have a great rest of your evening. Thank you. Take care.
Good night, everybody. Thank you.